One definition of the word murmur is to express one's discontent in a subdued manner. So it makes sense that a heart murmur is often a soft-spoken signal that something may be going on in the heart. The heart does not always shout to get our attention like it does with a heart attack. Sometimes it quietly whispers to those who will listen that there might be an issue. The murmur itself is not the problem. Rather, the murmur is telling us to look for one. Some murmurs are called innocent or benign. These are murmurs when the heart is normal, but the blood is flowing rapidly over the valves, which causes a sound. About 40 to 45% of children will have a murmur at some point in their life. No treatment is needed for these murmurs, and children will often outgrow them. But up to 10% of them do persist into adulthood. Murmurs that indicate more serious issues are often associated with valve disorders in the heart. The valves are the areas that open when the chamber of the heart beats and close when the heart is between beats, to allow the chambers to relax and fill with blood. Sometimes a valve does not fully close or will balloon backwards and allow blood to backflow across the valve. This backflow causes a murmur. This is called valve prolapse and can lead to blood regurgitation or regurg, which requires medical attention. A different type of murmur is caused by mitral or aortic valve stenosis. Stenosis is when the valve does not fully open, so the same amount of blood is forcing itself through a narrower opening in the same amount of time than it does in a normal valve. That extra pressure causes the murmur because the heart must work harder to push the blood through this valve. Over time, if this is untreated, it can lead to damage of the heart muscles. The most common murmur is aortic sclerosis, and this happens when the aortic valve develops scarring or stiffening or thickening. This can occur with age or after infection, such as rheumatic fever or endocarditis. This is not dangerous by itself, but if it progresses to stenosis, it can be a cause for concern. Often when the doctor hears a murmur, we may want to get a better look with a special ultrasound called an echocardiogram to see if we can find the cause of the noise. Once the cause is found, a follow-up plan can be made. When the heart whispers, we must always listen. By doing so, we may avoid further discontent, forcing the heart to raise its voice over a larger problem.